First thing, you do not need to do a mandibular advancement device without a good consent.
Regardless of the
regardless, I mean, whether it's a silent night, a provisional, or one of the more traditional appliances, you've got to do a consent. And as we know that there's basically no therapy that we do in dentistry that doesn't have some negative to it, and mandibular advancement devices are the same. First thing, obviously, if you advance the mandible, if the patient has significant TMD issues, you can introduce a TMD type of flare-up. The other things that are more common, though, if these are, for lack of better terms, orthodontic appliances, and they're putting pressures on teeth, so you can have some tooth movement, some jaw movement, some bite issues that can develop. So absolutely a consent needs to be used. But more importantly, if you are providing a sleep appliance, a sleep disorder breathing appliance without a diagnosis, you want to outline in your documentation why you're doing it. And it needs to be clear that that patient is going to be referred, and you're not doing it to go around a sleep physician. You're going and doing it to minimize symptoms, to minimize the effects of this disease until a diagnosis or another therapy is ultimately initiated. So the consent prevents, hopefully, any issues with the board, i.e. you're providing treatment without a diagnosis, or it prevents or minimizes the risk of doing a therapy that could have maybe a negative effect of tooth movement or jaw movement or any of those things. However, for dentists that are doing this, they don't really need to be worried about side effects of these appliances. Now let me explain that.
Are you talking specifically about the Silent Nite, or is this?
This is generally. Okay. The Silent Nite really has probably less side effects than many of the appliances I see, but dentists need to understand when we do a filling, a root canal, an implant, or whatever, the life of the patient is not at stake. Okay. Rarely do we do procedures that are going to extend the life of a patient. Dental sleep medicine is not that way. There's research everywhere that says an untreated severe apneic, his life expectancy is going to be 15 years less than a treated apneic. So if you look at the quality of life issues and the severity of OSA and the fact that it directly either causes or contributes to heart attacks and strokes and high blood pressure and diabetes and the myriad of things that we die from, but yet we don't treat the cause. We don't deal with the fact that OSA is initiating many of these things. So I look at a little TMD flare-up, which most dentists can easily deal with, or a little bit of tooth movement that might occur with these. It's almost like having open heart surgery, bypass surgery to save your life, and complain about the scar, okay? I look at my patients, straight in the face and say, look, if you wear this appliance long enough, you may get some tooth movement, but you'll be alive to know it. Okay, and I say, if that's going to be a problem with you, then you don't need to do this. Okay, and I have never had a patient, and we've had patients with significant tooth movement after years of wear. I've never had a single patient that couldn't eat, couldn't function perfectly fine, and worried about a little tooth movement. But they all have had good consents too. So dentists, if they're gonna do this, as I say, do it well. Okay, protect yourself, get a good consent, make sure the patients are informed, make sure the patients understand protocol, Make sure they understand why you're referring them.
Make sure they have an opportunity to ask questions.
Make sure they have an opportunity to ask questions.
That's right.
Thank you for bringing that up. Obviously, we were discussing that beforehand. One of the elements of consent is patients need to have time to not only read and understand the document and have the document explained to them, they need to have time to ask questions and say, okay, why is this in here? Or why may I get tooth movement? They need to understand that.